Right, this is Dr. Gerry Cuomo. I'm here with my veneer case, and I'm kind of getting through the first step right now. We've gone ahead and prepped the two lateral incisors for full ceramic coverage, only because they lacked adequate volume of tooth structure, so we decided to go ahead and wrap porcelain all the way around them. We may end up doing 3/4 veneers on the two central incisors and the two cuspids as well. So I've marked the lingual. I'm going to go ahead and put my finish line in on the linguals so that we know exactly where we're going. So I'll do one tooth at a time. I'm going to use a ball diamond that's about 1.75 millimeters in diameter, so we'll go about almost half that. We're just scoring for a margin. There we go. It's about where I want to be. And I'm going to come back here and do the same. And I'm not going too deep with this, just enough. Alright, good. Now, rinse that. That looks good. Now, have her close. Out left. Out left. Bite down. Okay, great. So we're like right above that that line with her occlusion. And open. And close again. And open. So the same thing on this side. I'm going to be above that. And just kind of get an idea of where I'm going with my lingual margin. Like I said, we're almost going to be 3/4 here for support. And we'll do another one on this side. Let me have you close out left. Close. Bite down. Okay, great. Open. So we'll be way above that. Okay. I'll just double check everything, make sure I got a good positive seat on every one of those areas. Maybe a little bit more here. There we go. Positive seat here. Alright, now I'm going to do a little interproximal reduction first. I'm going to do that. I'm going to take a small thin diamond, round end. How you doing, Diane? All right? Yep. Okay. I'm just going to adjust the scope head. A lot of my margins are going to be subgingival because we're closing a diastema. And I'm going to come right in with my KS0 burr that I've been using. I need another burr block. Just want to get the KS0 out. Okay. Alright, here we are. Now, my patient has already worn incisors and a worn labial, so I'm basically going to prep to the gingiva. I'm going to go even on both sides, right down the middle. And then we'll do some depth cuts after I do the inner prox. Zoom in a little bit. So we want to conserve as much enamel to the dent and enamel junction so that we can get good bonding here. But we have to wrap the porcelain. And the other way to do that, you have to prep more of the tooth. Alright, so I'm gonna just want to get everything lined up. I'm gonna prep my inner prox. And then to switch to another handpiece. It's a little quieter, my cabo. How you doing, Diane? All right? Yeah. Anesthetic holding up well? We're good? Great. Yeah. So I got to come all the way through. Now I'm going to take my an old Explorer. I like to do this. I get right underneath the tissue and put my margins in immediately. Okay. So I'll do the one prep and then I'll come back and do a cuspid. Okay, so here we go. Since she has a little recession, we've got to place our margin either right at the tissue level or a little bit below, or just into the sulcus. That's one of the hardest parts, so I'm going to do that first. So 3/4 veneering. You're almost doing a crown, but you're not. You're prepping, but you're not over prepping. You okay? Okay. Alright. So I'm putting my margin in now. I haven't done any labial reduction at all. And I'm pushing back this papilla so I don't nick it. And you can zoom in on that. So I'll take an instrument. Alright. So we're going to close the space. We've got to drop our margin down. And once you do that, you have the ability to extend porcelain and put pressure on the papilla as well, which is nice. And we can close in any triangles. Okay. I may touch it up a little bit when I place my retraction cord, but I don't want to do that yet. Okay, so I'm going to come around and just take a look around the other side. You okay? Turn a little bit toward me. To kind of keep you straight. You alright? Yeah. Out, please. Out, please. Okay, so there's my margin. I'm coming in now. I'm going to extend it right to where I'm going to be coming up on the lingual. Alright, so here and here. So now I'm going to do my my labial reduction and my incisor reduction, and I'm going to finish with the lingual and connect the dots. Now to figure out my labial reduction, I'm going to use a couple of jigs. One is my occlusal reduction, incisal reduction. I'm going to check that. And then I'm going to use my leaf to check labial reduction. Silicone index, you have to use that. There's no way else you can do it except for eyeballing. And that never works. Okay, so we'll need some depth cuts. Obviously, she's got lingual inclination, so we're going to take off, a certain amount. I'm going to look at it halfway through, so we'll take just half away. I'll do a depth cut here. Before I do a depth cut, I'm just going to measure my depth. The diameter of my burr is going to be about 1.5 millimeters. And I want to start off. Actually, it's 1 millimeter, so we're good. We can actually stay about half the depth, and go about half the depth of that. I'm also looking at the quality of her enamel. And careful not to over reduce. I'm doing a depth cut here. And we'll just dry that off to see if we're still on a good enamel. And dry it again. So here's a little bit of dentin showing. This is still all enamel. So now I'm just going to go ahead and take a thick burr. And then I'm going to connect the dots because I don't want to have any ripples, any turbulence in the surface itself. So let's take this and just lightly prep and get rid of the ridges. So no ridges. Well, it's a good idea just to take your mirror and just check And we can afford to reduce a little bit more. Well, we got an adequate reduction. Looks good. And checking the cross section here. Okay. Looking good. Once we get one done, it's easy to copy it. Still okay, Dan? Okay, great. So you want to take away just about most of the enamel except for a small thickness. But the other point is you want to use a lot of water because you want to maintain the dental enamel junction. That's got to be your strength for your veneer. Okay, so I'm going to measure my reduction, but I'm going to only go a millimeter because she's already worn away about a half a millimeter, so about a millimeter and a half reduction. So I'm going to go about a millimeter. Just put a little mark there and just take it down. Okay. There we go. Now we want to roll in the corners a little bit. Okay, I'm going to grab my mirror. Just about ready to do the lingual. Okay, so I'm a little disproportional. I want to bring my distal labial in just a little bit. Tiny bit with that. There we go. Okay. Now I'll take my football diamond and I'll finish up with I'm going to finish up the lingual reduction. Alright, slower. Okay. I'm going to use a fine diamond football. It's a small football diamond on the lingual because I don't want to cause too much trauma to her enamel. It's, you know, as we get older, our enamel gets more and more brittle, so we need to account for that. So what I'm going to do now is I'm going to relieve the lingual incisal. Okay. Air on the mirror. So it's just like a crown prep, really. It's 3/4 coverage. And we're just being more conservative with our preparation. Alright, so I'm going to finish the rest of the prep up with the KS burr, and then we'll come back and show you a cuspid and a finished here. Out left, bite down. Great. So there you see it, she's hitting way away from the margin, perfect location. we'll smooth everything up, and when we finish on the cuspid, I'll show you the next step. That's it from here. See you next time.